name's Sarah Haroff, and I'd like to take a few minutes to teach you how to use the BioVigil hand hygiene reminder and awareness system. We typically do our trainings in person, but sometimes the circumstances of the world don't always allow for that, so I thank you for taking this time to watch this video. It'll take about 5 minutes to walk you through the various system components and how it operates. First of all, there's the BioVigil key. It looks like this. It's got a little button on it. This key is individually assigned to you, and you will receive it from probably your hospital's infection preventionist or possibly a manager. But you'll want to keep this key with you at all times. Most people just attach it to their ID cluster. It can go on the back so it doesn't cover your name or picture that's on there, but you use it to pick up and activate a BioVigil badge. This is a BioVigil badge. It weighs about 2 ounces. It's got a light on it. Typically the light is green. It should be green. The green indicates that you are compliant with your hospital's hand hygiene policy. If it's yellow, that means that it's a reminder of hand hygiene. And if it's red badge, that means that you are not compliant with your hospital's hand hygiene policy and you need to do hand hygiene as soon as possible. The best place to wear the badge is up on the shoulder. What we recommend is that you just grab the seam of your scrubs, pinch it, and attach the badge. This is a BioVigil base station. They come in 2 sizes. This is a smaller one. You'll see these around the hospital in the nursing units and in various ancillary departments. Any badge that's green on a base station is ready to use. If it's red, it's charging or going through some sort of diagnostic or software update, but green is ready to use. This is a BioVigil beacon. You'll see these in various sizes throughout the hospital, above the thresholds, inner and outer thresholds of patient rooms. You'll also see them at sinks where it detects a sink wash. I'll explain that in a little bit more detail coming up. Those are the main 4 components of the BioVigil system. Now, the BioVigil system, as I'm sure you've already become aware, is a reminder system for hand hygiene. When you go through a patient's doorway threshold, the system is going to be looking for hand hygiene within a period of time that is compliant with your hospital's policy. If you hadn't done hand hygiene within that compliant period of time, the reminder system would start. But first, how do you get a badge? So you can go over to the base station, pick up any green badge off the base station. When you first pick it up, its color is going to change to purple a little bit. That simply just means that it's unassigned to you and you have a couple of minutes, I believe it's 2 minutes, in order to activate the badge. You do that with your key. This is really the only thing that you need your key for. You point the flat end of the key at the badge, at the hand of the badge, click it, activates it, it turns green and it makes that noise, so it's ready to go for you. That's when you'll then want to grab a hold of your scrubs or whatever it is that you're wearing, pinch the seam, attach the badge up high. Now, our intention is not to change your workflow at all. We've actually been operating in hospitals for 5 years commercially and several years longer than that, where we simply observed hospital workflows, and we've worked in as much as possible so that the system is designed to keep you working like you normally would. The only thing that's new now is whenever you do hand hygiene, you're going to confirm it on the badge. How do you do that? There's 2 ways to do it. If you are using sanitizer, grab the appropriate amount of hand sanitizer, rub it in like you normally would. Then you take a cupped hand, hold it up to the badge. It makes that positive tone and it confirms the hand hygiene event. The way it's operating in that sense is it actually has a breathalyzer inside of it. So when you rub that alcohol rub into your hands, it's releasing the fumes. You hold that hand up to the badge, a small fan inside the badge will start up and draw in those alcohol fumes and confirm that hand hygiene has been performed. It's sensing the alcohol. It's also sensing the shadow of your hand and the presence of your hand. So you'd want to use a closed cupped hand. You don't actually have to cover or don't actually have to touch the badge at all, but you do want to make sure that you're blocking out the light and that your hand is curved around it so it's concentrating those alcohol fumes. So that is how you confirm an alcohol event on the badge. I'll do it one more time for you. I'll actually do it several more times for you, but one more time right now. Rub in that alcohol, closed cupped hand held up to the badge. Positive tone. If it's green, it'll stay green. If it's any other color, it'll turn green. Now, what if you're in a situation where you need to wash your hands at the sink? In that case, you would just walk up to the sink like you normally would. You'll see beacons above the sink, as I mentioned before. This beacon is going to detect your presence at the sink, or it's actually detecting the presence of the badge. After 20 seconds or 15 seconds, depending on what the settings are at your hospital, the badge is going to beep and turn blue. It's hard to see the difference right now, but right now this is a blue badge indicating that I have been at the sink long enough. I then take my hand, hold it up to the badge, simply to confirm that I completed the sink wash. I don't know if you noticed, it went back to green. So again, if you are washing your hands at the sink, you don't have to push any buttons or anything like that. Just walk up to any of the sinks that are outfitted with the BioVigil beacon, wash your hands like you normally would. After the appropriate time interval has passed, the badge is going to beep and turn blue, indicating you've been there long enough. Hold your hand up, wet or dry, the badge will go back to green. So those are the two ways that you let the badge know whenever you've done hand hygiene. As long as you do hand hygiene within typically a minute, every hospital has slightly different settings, but most hospitals allow a minute window. So if you do hand hygiene within a minute before entering a patient room or within a minute before exiting the patient room, the badge is just going to stay green. If you wait until you walk into the room to wash your hands or wait until you leave, the reminder is going to start. I don't know if you see it or not, but the badge has now turned yellow, and it's going to beep and vibrate at intervals for 60 seconds, which is that 60-second window that now I can do hand hygiene and still remain compliant. So if I didn't do hand hygiene upon entry or upon exit, the reminder will start up. That means that I have 60 seconds in order to complete hand hygiene. If you didn't complete hand hygiene within that minute, the badge would turn red. Red is what you're trying to avoid. What do you do if you have a red or a yellow badge? Do hand hygiene as soon as possible. Sink or sanitizer, it usually doesn't matter. Badge goes back to green. Now, sink or sanitizer usually doesn't matter. As you all know, in certain situations when there's a C. diff patient, the badge, or when there's a C. diff patient, you need to do a sink wash. The badge has a way of reinforcing that. So certain people at the hospital have been designated to change rooms over into what's called the C. diff setting. They've got sort of a little remote control that does that. You'll know if the badge is if a room is in the C. diff setting just because of the normal signage that typically would be on the room with the contact plus patient. But when you come out of a room with a C. diff patient, the badge is looking for a sink wash. If you try to use hand sanitizer coming out of a room where there's a C. diff patient, the badge is not going to accept it. What it'll do is it'll flash blue several times because it's directing you to go to a sink. Blue, think blue water. So C. diff patient, if you try to use sanitizer, the badge is going to reject it. Flash blue several times to direct you to the sink. Then you would do your sink wash, wait for the badge to turn blue, hold your hand up to it, wet or dry, and your badge will go back to green and you're good to go. So as a reminder, just to walk you through what we've covered so far, 2 ways to let the badge know when you've done hand hygiene. Either use sanitizer, hold your hand up to the badge to confirm it, or wash at the sink. After the appropriate amount of time, the badge will turn blue, hold your hand up to confirm it. If you don't do hand hygiene with a room entry or room exit, the reminder sequence will start. That simply means to do hand hygiene as soon as possible. Now we do have a couple of workflow considerations built into the badge to make it work with how you do your job. As you know, there's that 60-second window on each side now of where you can enter or exit a room. So if you are carrying equipment, a tray, something like that, where your hands are full or occupied and you aren't able to do hand hygiene with your room entry, the reminder would start up. Simply when you get into the room, set the stuff down, obtain some hand sanitizer, or go to the sink and perform hand hygiene. But you have that window built into there. Also, if you need to enter a room to do something quick, like a bed check, just to see if your patient is still in bed, you can walk into the room, the reminder will start up. If you need to leave, then if you leave within 60 seconds, the badge reminder will cancel. So you can still do quick entries or exits. Another good example of that is often if you are just going into the room to write your name on the board and introduce yourself to the patient. The reminder would start up. If you leave within 60 seconds, it'll cancel. Now, many hospitals have a care ready policy. It doesn't matter what you're going into the room for. You're always expected to do hand hygiene with entry and exit. If that is the case, follow that policy. But right now, with the way your system is established at your hospital, it does allow for quick entries and quick exits. Same thing if you're in the room and you need to step out and go into the hallway briefly to ask for help. The reminder would start up. If you're back in the room within 60 seconds, it'll cancel. Another workflow allowance, if you leave one room, do hand hygiene, go right into that next room all within a 60-second period, the system isn't going to prompt you to do it twice. You're going to get credit for doing hand hygiene with that exit, and you get credit for doing hand hygiene with that entry. It's not our interest to get you to do hand hygiene more than necessary, only what's safe and prudent and compliant with your hospital's policy. Lastly, if there is an emergency situation or some time when the hand hygiene is not the priority, you can put the badge on pause. If you squeeze it or press and hold, you do that for about 2 seconds or a second and a half. If you truly have to press and hold it, the badge will go into what we call the exemption state. It'll exempt you from one room for doing hand hygiene. So it'll start to fade in and out green. It's hard to see through the video, but this badge is actually fading. You can go then, whatever the first room I go into, I'm going to be exempt from doing hand hygiene. I can then go in, out, in, out, in, out of that room as much as necessary without the reminder going off. It was designed for emergency situations. It can also be useful when ambulating a patient or transporting a patient, or if you're cleaning or stocking or going in and out of an empty room. Those are all examples of times where it might be appropriate to use the exemption feature. Use your judgment as a professional. It'll stay in this faded state, in and out, one room, no time limit. As soon as you go into a new patient room, if you had not done hand hygiene yet, the badge would wake back up and go back to its normal state. It actually would go, if you entered a new room, it would go into the reminder state. Or you can always bring it back to solid green by doing hand hygiene, sanitizer, or the sink. I hope this helped walk you through the BioVigil system. Those are the basic components of it. Again, let the badge know every time you do hand hygiene. If you don't do hand hygiene with a room entry or exit, it will prompt you. You can put this badge in exemption mode if it's appropriate based on the work that you're doing at a given time. And then lastly, when you are all done with the badge, wipe it down with a Sani wipe. The front of it does open up, so you can clean on the inside here. You'll hear it beep while you're cleaning it because you're probably using something with alcohol. But give it a wipe down and then simply put the badge back into one of the slots on the base station. Doing it at an odd angle. There we go. Put the badge back on the base station. It'll flash blue briefly and then it'll likely go to red because it's charging if you've been using it all day. So clean the badges when you're done, or you might want to clean it when you pick it up just because you don't know if the person before you did it. We recommend cleaning it upon picking it up as well as dropping it off at the end of the day. You don't need to do anything with the key at the end. The key is simply to activate a badge. Thank you very much for your time. If you have questions about how the system works, contact your manager or infection preventionist at your hospital, and be safe out there. Thank you for taking care of these patients. And we thank all the healthcare workers and hand hygiene heroes out there. Have a wonderful day.